So welcome back, everybody. In the last lecture, we looked at, what are your different types of fatty acids. We look at the roles of cholesterol. We look at what types of food may contain omega-3 and omega-6 fatty acids and why they are essential in our diet. And now I want to kind of move on to cardiovascular disease. And basically, when we talk about cardiovascular disease, it's the major killer for, North Americans, for both men and women. And this kind of includes a variety of diseases of the heart and blood vessels. And the term coronary artery disease or coronary heart disease or simply heart disease kind of refers to that cardiovascular disease that affects the heart. We also have this term cerebrovascular disease, and that affects the brain and could lead to a stroke. Basically, it's kind of estimated that one person dies of a heart attack every 40 seconds in the US. And we also know that with stroke as well, it's also one of the top main killers, and number four after your other accidents, heart disease, cancer, and then you have stroke. And the symptoms of cardiovascular disease develop over many years and often do not become obvious until adulthood. Nonetheless, when we have done like autopsies or on 3-year-old kids, adults at 20 years of age, and it has shown that many of them had arteriosclerotic plaque in their arteries. But the findings indicate that plaque buildup basically can begin in adulthood and can continue throughout life, although it usually goes undetected over time. And the typical form of cardiovascular disease, which is known as your coronary heart disease and strokes, are associated with inadequate blood supply, blood circulation in both the heart and the brain, which is kind of due to that build-up of plaque. And we have to remember that blood supplies the muscle, the heart, heart muscle, brain, and other body organs with oxygen and nutrients. So when blood flows via the coronary arteries surrounding the heart is interrupted, the heart muscle will be damaged, okay? And that's what we have your heart attack, also called as your myocardial infection. And this is basically, death of part of the heart muscles because, it may result your heart to be irregularly or stop. And almost 25% of people do not survive their first heart attack. And similarly as well, if the blood flows to part of the brain is interrupted long enough, part of the brain dies, and that causes a stroke, which we also known as cerebrovascular accident. And okay, so we have a couple of whether there's modifiable risk factors. And when we look at this, the non-modifiable risk factors and how does it cause cardiovascular disease, we can look at it in terms of age, sex, and heredity. So when we talk about age, okay, men above age 45 and women above age 55, that's when they have to start an increased risk of developing heart disease. And this seems to be related, at least in part, of the sex hormone differences between males and females. So, women usually go menopause around age 50 to 55, and the level of female sex hormones declines, with this, and that kind of increases a woman's risk of developing heart disease. But for men, after the age, 45, 50, that's when, you have that increased risk. And so after women, experience menopause, they practically have the same risk of developing heart disease as men. Also, when we talk about hereditary, if you have family history, blood relatives, or anybody closer, um, and you have that stronger, any closer relative to you, that's when you have a stronger risk of kind of developing heart disease, okay, due to these inherited genetic factors. And so even here, when we talk about this, we can also talk about the modifiable risk factors, okay? And when we talk about your non-modifiable risk factors, again, diet and lifestyle can dramatically influence whether or not a person expresses their genetic factors. Okay, so basically, if you have proper diets and lifestyle, that can also influence whether or not a person expresses their genetic risk or it kind of decreases their risk. So apart from that, we always kind of associate heart disease with dietary fats. And while there is some truth in that, there are several other factors, and both dietary and lifestyle wise, that need to be considered. For example, smoking, even secondhand smoking, that can kind of increase your blood. Even if your blood lipids are in a healthy range, it can make your blood more likely to clot. And similarly as well, your lack of exercise, you're kind of just being a couch potato and everything like that. Again, when you start to when you start to exercise regularly, it can improve your insulin action. And so we want to kind of reduce that lipoprotein synthesis in the liver, and we will touch a little bit more about that when we go on in the next couple of slides. And then we have, issues like high blood pressure, high cholesterol, diabetes, and excess body fat. But I want you to kind of remember that heart disease is actually a multifactorial disease, and there are few factors that kind of play a major role in the development of the disease. And again, it's kind of, very much related to that dietary factors. And we will look at lipoproteins, which LDL stands for low density lipoprotein or high density lipoprotein for your HDL. And we will also kind of look at the oxidation of your lipoproteins. So a bit of tutorial about heart disease. Like I mentioned, the heart disease is kind of like, a cardiovascular disease is basically that umbrella term to describe several types of diseases of the heart and blood vessel. And the most common type of disease, and literally the lion's share of heart or blood vessel disease, is what we call arteriosclerosis. And in fact, most of the time, or all the time, doctors and others will use the term heart disease to simply refer to arteriosclerosis. And as you can see over here, we have 4 blood vessels that have been cut, okay? And we have the normal artery, early injury, significant arteriosclerosis, and complete blockage. And the heart muscle is one of the most important muscles. It's about the size of your fist. And the heart muscle must have a supply of blood vessels to bring oxygen and nutrients to the heart muscle cells. So when you have a classic heart attack, the blood vessels or the coronary arteries become diseased with arteriosclerosis. And and when you see the diagram over here, we basically see the cell lining and your muscle cells. And a healthy blood vessel is both smooth and flexible, and it's able to stretch and also accommodate changes in blood pressure throughout the day. And so, basically the first picture over here, you do not have arteriosclerosis. The artery has a uniform thickness all the way, and this is what we want, desirable. And the second one, we have this early injury, okay? And we start to see that beginning of that cholesterol plaque, okay? And the blood vessel wall is slowly thickening, it's becoming a bit narrowed, okay? But if somebody experiences this, it does not give anybody, it does not give a person symptoms. And some of the possible causes of this injury is again, kind of related to your diet and lifestyles, smoking, diabetes, blood cholesterol, infection, and high blood pressure. And then the third diagram over here, we have significant arteriosclerosis. It's the same blood vessel, but basically it's more advanced stage of the disease. And this can potentially be giving a person chest pain and exertion, but sometimes it's silent in a person. So we can see how in blood vessel, where the blood flows, basically it's very, very narrowed. We have this advanced arteriosclerotic plaque. And finally, in the last picture over here, we see complete blockage because apart from the arteriosclerotic plaque, we see this blood clot formation, and that kind of causes blockage of the blood flow, and that is what causes that heart attack. So when the tissues, the blood vessels supplies with oxygen and nutrients are kind of narrowed, it does not provide a good blood supply. Um, and because of the narrowing, and if that person exercises and then the tissues have an increased demand for oxygen and nutrients, we see that blood vessel kind of like in a crisis state because of just how little blood can actually flow through and carry that a required amount of oxygen and nutrients. Let me just kind of remove all this. And To kind of understand a little bit more about your lipoproteins, we have to kind of look at digestion, absorption, and metabolism of lipid. And we have to remember that, fat and water, they do not mix. So minimal digestion basically of fat occurs before they reach the upper part of the small intestine. Just to make it a little bit, I do not need you to understand all this, but basically lipid digestion kind of starts out from your mouth and then, it goes through to your stomach and then it reaches your small intestines. And once fats reach the small intestines, basically the gallbladder will stimulate to release bile and into the intestines. And bile is made by the liver and it's stored by the gallbladder and it's squirted into the intestinal tracts where fat is present. Okay, so bile will then kind of combine together with your bile acids that emulsify fat. So what does this mean is that it will split fat into small globules or pieces. And in this manner, that fat splitting enzymes basically, including, whatever enzymes that you might find in your pancreas, okay, and in your intestines. So they will work in that manner. And these enzymes basically break down these triglycerides into their component parts. And you remember what is a triglyceride? It's basically your fatty acids and your glycerol. And so that they can be absorbed back across the intestinal wall. And remember that your monoglycerides, triglycerides, with one fatty acids, they're all kind of produced. And once absorbed into the cells of the small intestines, the triglycerides are reformed. And so both shorter chain fatty acids and glycerol can travel freely in the blood because they are water soluble. But triglycerides, your monoglycerides, and also your cholesterol, they are longer chain fatty acids. And so, they would, longer chain fatty acids would kind of float in clumps and they will wreak havoc in either the blood or in your lymph. And so, and when we look at this, this is basically, the kind of digestion and absorption that goes on. This is more for your information. I will not actually be asking any questions of this, but kind of remembering that fat digestion kind of starts in your mouth, in salivary glands. And so because of that, we know that your fats and water do not mix. The body basically wraps them with protein and phospholipids to make them water soluble. And this resulting substance is what we basically call a lipoprotein. And, a combination of fat, which is your lipo, and protein. And lipoprotein basically plays a very major role in heart disease, as we will take a look later on. And they are particles that float in your bloodstream. So we do not eat lipoproteins. You do not eat your low density lipoprotein or your high density lipoprotein. Basically, your body or your liver makes this lipoprotein, and your main job is to transport fat around in the bloodstream. And remember, I did mention that we need to eat various types of fats, but not in excessive amounts. And lipoproteins, help in getting that dietary fats into the bloodstream and transport them around your body. So therefore, when we talk about lipoprotein, it delivers needed fats to various parts of various body organs. And so when we look at it, a lipoprotein, basically contains your triglycerides, phospholipids, cholesterol, fat-soluble vitamins, and they deliver this to your bodies. And, a lipoprotein can also be called as a chylomicron, okay? And it carries mostly your triglycerides and also some cholesterol from the intestine through the blood to the body cell. And they can either burn the triglycerides for energy or they can store them later. And here's basically a typical diagram of a lipoprotein. Just for your knowledge, okay, the outer layer where you have your cholesterol, you have your protein, you have your phospholipids are kind of located, and then you have your inner core where you have your triglycerides and some fat-soluble vitamins, cholesterol esters are kind of found. So we have, four major kinds of lipoprotein. And as you can see here, we have your chylomicrons, your very low density lipoprotein, your VLDL, low density lipoprotein LDL or your high density lipoprotein. But I just want us to, just for this class, I just want us to kind of pay most of our attention to LDL and HDL. So when we talk about low density lipoprotein, which is your LDL, it's commonly referred to as the bad cholesterol. And though LDL contains more than only cholesterol, and the liver kind of makes LDL. And what I mean basically is that the liver makes your very low density lipoprotein, and then the VLDL is secreted from the liver into the bloodstream. So as your VLDL circulates around it, it kind of delivers its triglycerides to various body tissue. So as this VLDL kind of gives up its triglycerides, it shrinks in size, okay? And then we start calling it low density lipoprotein, your LDL. So now what I have just described to you, I will not ask you in the exam, but I just want to kind of give you a sense of what organ makes your LDL and how it arises. So you kind of know ultimately it's the liver that makes your LDL. Also, I want you to know the function of your LDL. Okay, even though we call LDL the bad cholesterol, it actually has a normal, healthy function. LDL, basically, the main function is to deliver cholesterol to all your body cells. And remember, when we introduced cholesterol, we said that it had some important jobs in your body, and all cells require cholesterol. You just don't want excessive amounts of LDL. So all cells require some cholesterol, and LDL is basically the vehicle that delivers cholesterol to all your body cells. But when you have, high amounts of LDL, that kind of promotes atherosclerosis and kind of increases your risk of cardiovascular disease. So what we have here, okay, is a drawing of a healthy artery heart. Over here, let me just use some annotate function. All right, okay. And the artery is cut open to see the interior, and we see the inner layer of cells, where we call the endothelium, which lines the insides of your blood vessels. And then just deep to this layer of the endothelium, you see a light yellow tint called the subendothelial space, all right, there. And it's the subendothelial space where heart disease, also known as your arteriosclerosis, actually occurs. And it is in and it's this space where this arteriosclerotic plaque develops. And over here, you see as well this another picture, the same blood vessel, and now there is a large arteriosclerotic plaque, okay, that has developed in that subendothelial space. Do you see that large plaque basically kind of being pushed up the orange inner endothelial layer? And in doing so, has narrowed the space where the blood actually flows, right? And just what is in this plaque and what is in it. We will not go into every detail and all the substances that make up this arteriosclerotic plaque. Okay, it will take a very, very long time. And but one of the main ingredients is your oxidized LDL or your damaged LDL that kind of accumulates and accumulates over years. And in fact, you can see all these little yellow dots, over here. Basically, is the plaque that I circle in black, are kind of representing that oxidized, damaged LDL that has accumulated within this plaque. So the main issues that we're kind of looking here is how much LDL do you have in your bloodstream? With abnormally elevated levels of LDL, there is a much greater likelihood of LDL damaging and building up in the artery walls and building up a nasty plaque. And what is desirable is to have lower levels of your LDL. Another issue is what causes damage or oxidation to LDL, which really kind of accelerates its buildup in the arteries. And we will kind of look at that in the next few slides. And now we move on to your high density lipoprotein or your HDL. And it's also commonly known as the good cholesterol. And as the name suggests, you want lots of HDL. And the function of HDL is really quite the opposite of your LDL. And kind of remembering what I mentioned that all cells require some cholesterol, But like so many things in the body, your cell needs some cholesterol, but not too much. So basically, your HDL functions to remove any excess cholesterol from any and all parts of your body cells. And so this even kind of applies to disease arteries, walls, basically that, nasty areas of your plaque. And so your HDL basically can remove cholesterol from these sites. And that's why we call HDL your reverse cholesterol transport. In fact, across the country, many of your large cutting-edge hospitals have heart disease reversal programs. And these programs use a variety of intensive dietary, lifestyle, exercise, medication approaches to kind of shrink plaques and reverse heart disease. And one factor that it's focused on is your dietary and lifestyle factors that can help increase one's production of your HDL. And so that's why, the benefits of it kind of reduces arteriosclerotic plaque, reduces risk of heart disease, and also block oxidation of your LDL. So what are some ways that we can actually lower our LDL? And this is, to lower your blood levels of LDL. And so one thing is to kind of eat less saturated fatty acids. Okay, so cut down on consume less than 10% of your calories from saturated fats, replace them with mono and polyunsaturated fats, using vegetable oils rather than butter. Substitute skinless chicken, instead of beef, use no fat or lower in fat dairy products. We can also talk about consuming less dietary cholesterol. So again, emphasizing more plant-based food, decreasing your intake of sugars. So kind of remembering that fact that fructose readily converts to triglycerides, and we do not want that. And increasing your dietary fiber. So especially soluble fiber that kind of reduces the absorption of cholesterol in your intestines. And again, more omega-3 fatty acids like your fish, and also your more monounsaturated fatty acids like your olive oil, canola oil, avocados, and nuts. And what can we do to actually increase our to raise our HDL levels? Okay, so we want to remember that HDL removes the excess cholesterol buildup. So we want to remove this excess cholesterol laden plaques in this disease artery wall. So we definitely want to have more HDL. And what we can do to raise that is to kind of eat more monounsaturated fatty acids, again, canola oil, olive oil, nuts. We want to kind of also increase our fiber intake. We want to decrease our omega-6 fatty acids, so less corn oil, less soybean oil. We want to also kind of again stop smoking, increase exercise, because losing excess body weight will definitely help to increase your HDL levels. And again, we want to kind of increase more fiber, like having more whole grains, beans, fruits, vegetables to increase your HDL levels. And coming back to the next part where, I mentioned this now, it's not just how much LDL, but also if your LDL gets damaged or oxidized. So when an LDL basically, gets damaged or oxidized by free radicals, it becomes abnormal, or we say oxidized LDL. And it accumulates in the artery walls, inside the macrophage immune cells, and a nasty plaque is building up, and that's what kind of causes your heart disease. So, so basically, there are several ways that LDL can become oxidatively damaged. And one way is basically, your cigarette smokes, okay? Cigarette smoke that can basically kind of damage your LDLs. And so how we can protect LDL from this type of oxidative damage, we can make sure to have a diet that's rich in antioxidants. So example, kind of eating a lot more vitamin C, vitamin A, which is kind of found in your fruits, germs, nuts, seeds, and your wheat. We also want to kind of increase our phytochemicals, okay? So making sure that we have less amount, we want to increase again, same thing, our fruits and our vegetables, and also kind of increasing our monounsaturated fatty acids, and also stop smoking. And want you to kind of remember that when you eat a lot of fruits and vegetables, it's really associated with lower rates of heart disease, and this is partly due to the wonderful, colorful antioxidants and phytochemicals that are kind of present within your fruits and vegetables. And these phytochemicals basically help protect your LDL from oxidation. Okay. And so what are some of the symptoms of heart attack? You know, sometimes a heart attack can strike with a sudden force, like of a sledgehammer, with pain kind of radiating up from up the neck or down the arm. Other times it can sneak up at night, you know, masquerading as kind of like indigestion with slight pain or pressure in the chest. Sometimes, you know, you have that crushing chest pain. It's more common symptom in men. And many times the symptoms are so subtle in a woman that occurs before she or the health professional realizes that heart attack is taking place. So if you have any kind of like a suspicion of heart attack taking place, you should call 911 and then chew on an aspirin, but 325 milligrams thoroughly, and that kind of helps to reduce blood clotting that leads to a heart attack. So you can go through some of these common symptoms among men and women. They are a bit different. And what about a stroke? Okay. And again, symptoms of a stroke, you have that confusion, trouble seeing, severe headache. And so, you know, learn to kind of spot this signs. And if you lose a loss of balance, you know, blurred vision, one side of the face is kind of drooping, arms or leg weakness, speech difficulty, that's when you have to immediately start calling 911 and get them to the hospital. So basically, you know, what we want to kind of make sure when looking at a person's blood lipid profile. So doctors will usually do this blood lipid profile on persons for determining the person's risk to heart disease. And this is typically done when a person is fasting. So at least they should not have eaten for at least 8 hours prior to the blood draw. And while there are other blood tests that are considered above, you know, above are the classic things that are kind of measured, which is your total blood cholesterol, your blood level of LDL-C, your blood levels of HDL-C, and blood levels of your triglycerides. You see that a healthy profile, you know, a low risk to heart disease is seen in persons with low total cholesterol, also low LDL, higher HDL, and lower triglycerides. And conversely, when you look at an unhealthy lipid profile, higher risk to heart disease is seen in persons with elevated total cholesterol, elevated LDL and triglycerides, and lower LDL. All right. And also part of the importance is that these fatty acids have different effects on your body, levels of total cholesterol, LDL, HDL, and triglycerides. So as I'm going to end this lecture, I just want to kind of take a look at these two different types of food. You know, I chose some clear-cut examples and kind of remembering that your nutritional facts, basically a food label, it will always show your total fat, your saturated fat, and your trans fat, as you can see over here. Total fat, saturated fat, and trans fat. And so for this, you know, sausages over here, we see that the total fat of this is 24 grams, with 10 grams being saturated fat and, you know, 0 grams being trans fat. But basically, close to half of your fat that's found in these sausages are basically your saturated fatty acids. And the remaining 14 grams, you know, basically come from your monounsaturated and polyunsaturated fatty acids. But kind of remembering that fact that beef, you know, is largely corn fat. So there's this fair amount of unhealthy omega-6 fatty acids that are present. And on the other side over here, we have your guacamole, all right? And the basic ingredients are basically avocados, lime, lemon juice, garlic, maybe chopped tomatoes, spices, cilantro. And the main ingredient is the avocado, and that is where the fat is coming from this dish, okay? And this recipe actually is for 1 avocado. And so the serving size is, you know, basically a quarter of it. And so basically when you're looking at the nutritional facts label, what we mean is that when based on a quarter of a serving size, okay, it contains about 82.7 calories. And so it's not a whole entire avocado, it's a quarter avocado, and that's quite a lot of calories. And if you kind of look at it further and we kind of look at the total fat, we see that 6.7 grams of total fat. And that's kind of a big amount for a quarter of an avocado. And basically 0.9 grams is coming from your saturated fatty acids. And there are no trans fatty acids that's present as well. And the rest, basically 5 grams, are coming from a mix of your monounsaturated and polyunsaturated fatty acids. And I just want you to kind of remember that, the main fat that kind of predominates in an avocado basically is your heart healthy monounsaturated fatty acids. And I just have a few review questions. So, basically when we kind of look at this, which types of food in fatty acids can be obtained in these foods that are not found in larger extent to other food. So remembering you're talking about salmon and also flax seeds, basically it's your omega-3 fatty acids. If we're talking about, coconut oil and what type of fatty acids that kind of predominate. And I hope that you remember it's just saturated fatty acids, all right? That kind of gives it a bit of its semi-solid kind of structure. What actions kind of help to increase your HDL? Basically, we know that we want to just, of all the answers over there, the correct answer would be quit smoking. And which actions protects LDL from oxidation? It's all of the above. Basically, we should increase monounsaturated fatty acids, increase consumptions of nuts and seeds, and also increase your consumptions of fruits and vegetables. So with that, we will end here, and I'll see you guys in the next module. Take care.